Welcome friends to Time with Thebsian. Today we will be discussing about the medical devices used in the abdomen and the pelvis. These are the two important regions in our body. We have come from top to bottom. In the abdomen lies just below the chest, and the devices may be very common for the thorax and or the chest and the abdomen, considering them incidental and non-pathological. However, it is essential to be aware about the complications of the devices. Thorax or in the abdomen, main devices will be tubes, because for various diseases, tubes are used to drain or provide medicine or support. Stomach tubes are there, nasogastric tubes are there, ryle tubes are there to give feeding or food to the patient who cannot use the esophagus. Intestinal tubes, multi-abbot tube, not used now. Electrolytes tube, that means you have to give food for the patient. Patient should be given only saline. That means salt. For that, a special tube is being used. Then gastric lap band, gastric balloons, jejunostomy tubes, and like that, so many names we come across through the abdominal area. So we know that abdomen, we don't get chest pain as often as we get stomach pain. Stomach pain can come just because of the food or because of urine retention or retention of the stool. So many devices are used in the abdomen. Just below the abdomen is the genitourinary devices. Just below the abdomen is the area containing genitourinary organs of the body. There we use ureter stent, then metallic stents are used, plastic stents are used, bladder and neck stents are there, where urine bags are fixed. Then some people will have leaking of urine. There the sphincters are fixed as device. Then you know and have seen Foley catheters for taking out urine. Then some devices are used in the kidney directly to drain. Then for dialysis, the approach to kidney or the peritoneal cavity is in the abdomen. Then we know that for very common problem in the present day is the lack of children, lack of normal birth of children. So there is lot of equipments in the use to examine the vagina and the ovary to find out what is the problem. Lot of devices are being used. Then lot of observation tubes are fixed up. Then lot of samples has to be taken. For all these, one or the other devices used in the genital area. Then there are other group of people who use lot of intrauterine devices or sterile things so that they don't get any children, they don't get pregnant. For that also there are so many medical devices. So in the case of the urogenital area, we see a lot of devices. And each person will have one problem. So the problem or the devices used by in this area may need not be very common. So anybody has got doubt about this use of these devices, especially for preventing pregnancy or getting pregnant, has to consult their own doctor, and without the consent of the doctor, they should not use it on the advice of their friends. So another thing is that the continuation, vasectomy devices are there. Pessaries for different purposes are there. Then penile prostheses are there for enlarged penises, enlarged penis and tandem and ovoid implants are gynecologic brachytherapy. Then tampons used by ladies, menstrual cup, sacral nerve stimulator, etc. or other urogenital devices used in the particular area. So while describing the various devices, there may be you may see some mix-up depending upon the tampons, menstrual cup and pessaries, etc. But this could be a guidance. Use this presentation as a guidance so that you get an idea about the vasectomy devices or pessaries or penile prosthesis. So if you are interested to get more, consult a doctor or go to a medical book to get knowledge about that. And if you have got real problem, consult a specialist. If you want to have guidance on these matters, you can talk to me, ask me questions, kindly write to me so that I can write back giving you specific information. If you think, as I said earlier, medical devices are many, but each medical devices may need an auxiliary device as a small tube or a clip or a binder, then as a filter like that. So that it is essential that you people listen carefully and clear your doubts by asking me or talking to a medical specialist. And one very common feature is that many of the genitourinary devices may migrate. Doctor may put it in one place, but the device may migrate from that place to another. When it migrates from the intended place, it becomes a hazard. Especially the intrauterine device, which is very commonly called as loop, it migrates, or sometimes it may be covered by connective tissue, and you may not see, doctor may not be able to pick it up the way he used to pick normal patient. So migration is a very important point, and do not get upset when something is not seen, because a doctor will be able to locate it very naturally and safely. Do not search for it yourself, or mentally do not get upset. There is cancer of various organs or areas that are in the abdomen and urogenital area. So as part of cancer treatment, radiotherapy beads or points or pellets could be implanted for some duration. So do not meddle with those implants yourself. If there is inconvenience or any problem, irritation or redness, kindly talk to your doctor. Then, I told that about the tubes and accessories. There are plenty in this area, used in this area. Do not get upset when you see something special or some irritation. You kindly talk to your doctor. And the abdomen or in the urogenital area, sometimes neurostimulation will be required, so to enhance or for the normal function of a certain organs. So there will be stimulators placed inside this abdomen and urogenital area and attached to battery packs outside the body. So this area is very important, and specifically I will recommend all the people attending time with Thebsian, you have any doubt to go to doctor, kindly talk to me. I can assure you why you should talk to doctor. And I can counsel you and support you and get you and give you the strength to go and see the doctor. So this session is going to conclude. We'll see you next Friday with another topic. Thank you for watching Time with Thebsian. Please remind that there is a Malayalam program on the same topic, same day.